At the Institute of Aesthetic Surgery, we inspire confidence. Serving the Orlando area, our goal is to help people fully develop their God-given potential. We offer the most effective and efficient cosmetic procedures in a loving and caring environment, using the latest techniques and technology. At the Institute of Aesthetic Surgery, our desire is to provide you with the finest personalized care while creating beautiful, natural results that turn your dreams into reality. Using a combination of cosmetic surgery, lasers, injectable dermal fillers, and skincare, we can help you achieve the look you want. The Institute of Aesthetic Surgery is led by Dr. Richard Gregory and Dr. Roxanne Silora. Dr. Gregory is a board-certified plastic surgeon whose passion and expertise are in facial rejuvenation and laser surgery. He is recognized in America's Best Doctors and Best of the Best by Self Magazine. He was also listed in Top Doctors as one of the top plastic surgeons in Central Florida each year from 2000 to 2013. Dr. Silora is known for her expertise in breast enhancement, reduction, and body contouring. She has been recognized as a top plastic surgeon by Consumers Checkbook, as well as one of America's top plastic surgeons by Consumers Research Council of America. At Institute of Aesthetic Surgery, we are inspiring confidence through enhancements and cosmetic surgery. Contact us today, and we'll help you achieve your maximum potential.
We're born with perfectly smooth skin. It's healthy, it's hydrated, it glows. But with age, our body's natural hydrator, hyaluronic acid, diminishes, and skin loses its ability to hydrate itself. At Skin Medica, leveraging the skin's ability to rejuvenate itself is a science and our passion. Introducing a new chapter of skin hydration, HA5. 5 forms of hyaluronic acid work synergistically for immediate smoothing and continuous hydration throughout the day. And over time, patients experience lasting rejuvenation. Skin Medica's exclusive VitaSense technology harnesses potent antioxidants found in Vitis flower stem cells to replenish your skin's own hyaluronic acid and support long-term skin health.
HA5 has been a wonderful topical to use immediately after injections, whether it's with neuromodulator or fillers, because they get this immediate gratification from applying this topical that brings in a lot of hydration to their skin. After using it for 4 to 8 weeks, they're noticing a longer lasting effect from HA5.
Since my dermatologist recommended HA5, I've really noticed a change in my skin. It's smoother, it feels like the wrinkles are less apparent, and it's really made me feel better about myself and more confident in my skin.
Backed by science, advanced technology, and clinical proof, Skin Medica creates revolutionary skincare products for physicians and their patients. Restore your skin's ability to hydrate itself and return to exponentially smooth, rejuvenated skin. HA5 Rejuvenating Hydrator.
Before, I was getting up 4 or 5 times a night to go to the bathroom. So it was interrupting my sleep. I was tired all the time.
We used to do jump rope competitions. I couldn't jump rope. I couldn't do double leg jump. I had to do single leg. And it started there.
Well, it's age, pushing 50, and having kids. It's just the way that it is. The equipment gets weak.
I would run to the bathroom. I would leak.
What it does is it kind of takes place of doing Kegels, which a lot of people don't have the time or the energy, and quite frankly, it's uncomfortable to sit there and try to do Kegels.
Electromagnetic waves that pulse around the muscles that force tightness to occur from the inside all the way to the outside.
Usually when you come into a gyno's office, okay, take your clothes off. You know, I sat here in my blue jeans and just read a book. And it's the easiest thing I've ever done here.
It was actually good.
So the first time I did it, it was like, whoop, okay, little odd, but it becomes very tolerable.
25 or 30 minutes you sat on this chair reading a magazine. That's probably the most I ever sat down and relaxed in my normal day. It's freeing, very freeing. To be able to just do what you want to do again.
Better control over when I do have a contraction. I can handle it better.
If I ran across somebody who complained about the problem that I had, or even something more severe, I would actually say, hey, I have a doctor. All you have to do is sit in a chair 6 times. Sounds a little strange, and you don't even have to get undressed, and it works. So I would absolutely recommend it.
It's awesome.
You inherit lots of traits from your family. My ancestor, Lady Beatrice, introduced the Elizabethan ruff. Great-grandfather Horatio went west during the gold rush. And Aunt Susan was a world champion. I inherited their can-do spirit and their double chin. Now I'm going to do something about it.
Kybella is the first of its kind injectable treatment that destroys fat under the chin, leaving an improved profile. Kybella is an FDA-approved non-surgical treatment for adults with a moderate amount of fullness, or a bit more. Don't receive Kybella if you have an infection in the treatment area. Kybella can cause nerve injury in the jaw, resulting in an uneven smile or facial muscle weakness and trouble swallowing. Tell your doctor about all medical conditions, including if you have had or plan to have surgery or cosmetic treatments on your face, neck, or chin, have had or have medical conditions in or near your neck, or have bleeding problems. Tell your doctor about all medicines you take. The most common side effects are swelling, bruising, pain, numbness, redness, and areas of hardness in the treatment area. Find a doctor at mykybella.com.
This is not a facial. Nothing compares. For all faces, change is possible. This is a committed relationship. Enjoy the experience. 3 steps.
30 minutes. The best skin of your life.
Delight in the results.
Live confidently.
Through amazing skin.
Face light.
Face light, face first. Beauty is a feeling.
I feel very strong, radiant,
confident,
amazing, empowered.
Let's do this again. Not a facial.
Not a facial.
Not a facial. Hydrofacial.
I started to lose my hair in my mid-30s.
About 49, I started to get receding hairline in the temple areas. And it started to affect me a little bit.
I was feeling embarrassed, I was feeling ashamed, and I was feeling older than I really was. One of the things I used most often were hats. Eventually, I started using the pills and the potions and the lotions to help hair regrowth. And after several years, nothing was really working for me.
What I found is that there was a strip method out there where there was a pretty invasive procedure.
When I looked into hair restoration, The thought of a scalpel or sutures or staples, and certainly a linear scar between my ears, was unacceptable to me.
A friend of mine told me about the NeoGraft.
And then I discovered NeoGraft, and that was a game changer for me. NeoGraft was a game changer for me for several reasons. I could go back to work the next day.
It was a very minor procedure. I drove myself here, they put local anesthetic on, I didn't feel a thing.
I could go back to working out a few days later.
I had about 1,500 grafts.
I could keep my hair short if I wanted to down the road.
I actually went back to work and had to drive down to Houston the next day.
I had options with the NeoGraft.
Was very pleased with the outcome, and at about 5 months my hair started coming in and it started to make a complete difference in my life.
For me, being athletic, wanting to get back to working out, playing basketball, playing golf as quickly as possible, that's why I chose NeoGraft.
We're all too well aware, me more than most, that as we age, our skin loosens and sags. But we love it when our beauty expert, Mickey Williams, is here because she brings us new and innovative ways to look younger without surgery. And today, Dr. Gregory joins her to tell us about Face Tight by In Mode. Mickey, my heart is pounding. Tell us more.
I have heard so much about Face Tight, and I am so excited to have Dr. Gregory here because it is incredible. It's unbelievable. So please tell them what Face Tight is.
All right. Well, Face Tight is a means for rejuvenation of the skin. You know, our skin, basically, they say plastic surgery treats the skin and its contents. Well, the skin's what we see. And like we said earlier, you know, natural beauty is unfair. I'm going to be a little bit unfair this morning. So we're going to talk about how to rejuvenate the skin and make a person look better.
Great. So how does it work?
Well, the Face Tight actually is radio frequency. We have a lot of different kinds of energy, and almost all of it boils down to heat of the tissue. How the tissue responds then gives us a different results as far as that goes. But Face Tight heats by radio frequency. It's actually a probe. In the past, what we've done is things from the outside, it doesn't penetrate very well. What we need to do is treat the underside of the skin. For instance, this is the epidermis, the dermis, where really the wrinkles and scars start, and the fat and supporting structures down here. So basically, there's a probe that is inserted that energizes the tissue and stimulates it to repair. So you're shrinking the collagen, which is mostly this pinkish looking stuff here. You're reorganizing, rebuilding the collagen, and you're basically tightening the structure that supports the skin, the ligaments, and so forth. You're also melting fat. So for people who have a little bit extra fat, they're going to actually get rid of that too, as well as tightening the skin. And it's probably the best thing next to a facelift. I've been a plastic surgeon.
Yeah, you've been doing this for over 30 years, and this is the most innovative thing you've said that you've used,
really
which is
This
unbelievable.
is the latest and the greatest. I've been doing laser for more than 30 years, and lasers were a big advance, but this is probably the best thing we have right now.
Well, I think we have a video too. This is how it's working. Can you tell us what's happening?
How much downtime? Now that's a question for me. How long will I have to be off from work?
Theoretically, you could be out the next day, but there's going to be some swelling. And so we normally put a patient in pressure dressing and ask them to wear it for 3 or 4 days just to keep the swelling down. But you could be out the next day shopping.
Oh, great.
Just with your dressing on.
Yeah.
And that's okay. So
that's a good idea.
when you talk about the probe, it's not actually going into my skin?
It's under the skin.
Okay, so where's the
no
insert
incision.
work?
Well, there's several of them, and it's nothing more. It looks like a cotton applicator, a Q-tip.
Right.
And basically, you just put it in there. The nice thing about this technology, though, is that it's perfectly safe because it monitors the skin temperature, and we can read that as we do the treatment. So you're treating the skin temperature, but you're actually heating it from
going
below.
in. So like a topical numb then to make the tiny incision to put the probe in?
It's
numb
all
it up.
energy. So it's like he was explaining, it's energy that's going through and creating all of this, and the tightening and the melting and everything else. It's unbelievable.
You can get a tremendous amount of typing that way.
Well, show us some before and after.
Yeah. All right.
What difference does it make?
How many treatments do you typically need?
I recommend one to start with. You know, if a patient needs another,
look at
that's
this.
enough.
This is amazing.
Wow.
So
Now
tell us
about this person. How many treatments did this person have?
This is one, but you see that actually melted the fat. This is the problem with people. It's not only loose skin, but it's fat in the neck.
Yeah.
And you see how it tightened up and gave you a nice neck angle.
That's unbelievable.
Oh, I love this. Okay, let's see another one.
Wow.
Okay, here's
look
the
how
loose
much
skin.
tighter.
A lot of that's muscle, though, and the bottom line is that the muscle is what causes the bands in the neck. And so we're tightening the skin, melting the fat. There's some muscle tightening, too.
So you're controlling where this melting and rejuvenation is happening.
Exactly. It's very precise.
Yes.
The jawline, it makes a huge difference.
I love this one. Look at this.
Sure.
It's unbelievable. And I know it's actually, you can use it on the body as well, right?
It's called Body Tight. It's the same energy. It's a different probe. It's slightly longer as far as it goes, but it melts fat and it treats areas that we really haven't been able to treat very well in the past. For instance, the arms.
I know.
We call them.
Really? You could help with the arms?
The whole table just
the bra fat. That's right. Sure, we have.
It's a miracle.
That little armpit thing, really? Oh my!
Yeah,
It's so very targeted, and it's so incredible. And like you said, it's the most innovative laser, or innovative kind of procedure that you've seen. And I think that's unbelievable.
Well, if you want to know more, like we all want to know more, you can understand that. You can go to Face Tight by In Mode on their website. It's inmodemd.com. Next, a classic story comes to the Players Center.
Hi everyone, my name is Liz Kennedy. I am a celebrity skincare expert, and we are here to explain what is a chemical peel. A lot of people simply don't know what a peel is. What the peel does is it helps target fine lines, wrinkles, sun damage, pore size, which is a huge issue for a lot of people, acne scarring, acne itself. It helps the skin think differently. It's changing the thought process of the skin. It's turning over new skin cells. It's basically training your skin how to start all over again. The VI Peel is suitable for all skin types. It's painless, little downtime. What I like to do for my clients is have them come in on a Wednesday, because by the time Friday rolls around, you'll be peeling over the weekend. So the first day of the peel, nothing will happen, as well as the second day. You will start peeling on the third day. With the take-home kit, you'll receive a cleanser, an SPF 50, as well as the post-peel protectant and the post-peel pads. And the post-peel protectant is simply just to use it to relieve you of any dryness or tightness, which is completely normal. And that's it. So again, it's really simple. It's not going to affect your work life. You're looking at approximately, I would say 6 to 7 days when the peel is completely done. After you get the peel, you don't have to go home and not be able to live your life. You can go to work, you can go shopping, you can go out with your friends. This peel does not interrupt your life. We really want to educate consumers on just how easy a peel is and how it does not interfere with your life, and remove the whole stigma of Samantha from Sex and the City, of your face being red and raw and tight. It's simply just not the case in this day and age. So if you have any more questions or concerns, you can go on to viaesthetics.com and find a provider within your area to do the peel.
At the Institute of Aesthetic Surgery, we inspire confidence. Serving the Orlando area, our goal is to help people fully develop their God-given potential. We offer the most effective and efficient cosmetic procedures in a loving and caring environment, using the latest techniques and technology. At the Institute of Aesthetic Surgery, our desire is to provide you with the finest personalized care while creating beautiful, natural results that turn your dreams into reality. Using a combination of cosmetic surgery, lasers, injectable dermal fillers, and skincare, we can help you achieve the look you want. The Institute of Aesthetic Surgery is led by Dr. Richard Gregory and Dr. Roxanne Silora. Dr. Gregory is a board-certified plastic surgeon whose passion and expertise are in facial rejuvenation and laser surgery. He is recognized in America's Best Doctors and Best of the Best by Self Magazine. He was also listed in Top Doctors as one of the top plastic surgeons in Central Florida each year from 2000 to 2013. Dr. Silora is known for her expertise in breast enhancement, reduction, and body contouring. She has been recognized as a top plastic surgeon by Consumers Checkbook, as well as one of America's top plastic surgeons by Consumers Research Council of America. At Institute of Aesthetic Surgery, we are inspiring confidence through enhancements and cosmetic surgery. Contact us today, and we'll help you achieve your maximum potential.
Everywhere I go, outside and inside,
doesn't suit me anymore.
They say time lives it smart.
Some things you can't take back.
But I am not just anyone.
I'm ready for a change.
It's time for me.
It's time for me
to begin again.
Pico 4 can disperse a rainbow and give you your skin and your confidence back. Pico 4, the new way to remove color-pigmented tattoos and unsightly skin blemishes for good. Pico 4 is effective on all shades of skin tone. The color of your blemish or the color of your skin do not matter.
The Pico 4 is just so versatile. It can treat skin types 1 through 6, so you're basically covering the entire patient population and the main things that people come and see you for.
I use it a lot more than I expected for skin rejuvenation, facial toning, pigmentation issues. It's just a wonderful tool.
It allows us to go deeper into the skin to really get all the pigment out in the tattoos. And the reason why that's important is that it allows for faster clearance and a safer type of clearance for that tattoo.
The new Pico 4 uniquely targets both large and small particles simultaneously, breaking them into tinier particles that are naturally removed by your body. The laser targets only the ink or the unwanted lesion without harming the surrounding skin. Pico 4 deletes tattoos you no longer want to keep and removes skin blemishes you thought were impossible to get rid of.
What I love about the Pico is that it's virtually painless and it has very little downtime.
Pico 4 clears the way to a new you, the new way to undo the unwanted forever.
Pico 4, you new.
It's time to get even with skin discoloration. Lytera 2.0 is a re-envisioned, reformulated, and rejuvenated product. Patients suffering from hyperpigmentation often describe their skin as having blotches, scars, and age spots, appearing dirty and uneven.
I just noticed in here the dark marks were getting larger, and I've tried so many different things, but nothing seemed to work.
I had noticed it under my eye and towards the back of my cheeks. I have no idea what this is. It's dark, it's ugly. People are looking at me and they're telling me, oh, your skin looks weird.
Melasma is hyperpigmentation of the skin that you see in adults. This is affecting their self-confidence and their self-esteem. People want it fixed. They want to come up with their most perfect shade of even and embrace their diversity. In terms of the causes of hyperpigmentation, intrinsic causes of hyperpigmentation would be your genetics and also your stress level. That interplays a bit with your hormones, which is also intrinsic. And then in terms of extrinsic, it's really sun damage. That's very significant.
There are multiple known pathways of hyperpigmentation, and so it's very important to understand the biology of pigmentation very thoroughly. At Lytera 2.0, we started working about 3 years ago, and that's because newer pathways were being discovered by skin biology. It's important to then find ingredients that can affect all those different pathways, combine them into one to provide a 360 approach to pigmentation control.
Because of differences in melanin biology, ethnic skin can be some of the most challenging skin to treat. The Lytera 2.0 actually addresses very stubborn hyperpigmentation, and then in addition, it works beautifully on all skin tones, and it's retinol-free, and it's hydroquinone-free. That's very important to a lot of my patients. We can even out the skin tone while we're not drying or irritating the skin at all. And then I will do chemical peels here in the office. I love the Vitalize and Rejuvenize peels, and I do a lot of them. So it's kind of like steps and levels to get my patients to where they want to go. I have a couple of my patients using the Lytera 2.0 right now in a small clinical trial that I'm doing. They like the product, it's non-irritating, they feel like their skin is a bit more even, and we can already start seeing results that I feel will be more progressive as we go along. So I'm excited and they're excited.
I'm very, very happy with that product. It evened out my skin tones and it didn't irritate my skin. It brightened my skin when I put it on, and I saw a difference in such a short period of time that I was amazed.
I was definitely feeling a lot more confident because of the Litera 2.0. My skin had started to even out a lot more, and I was very happy to see that my skin had started to have that glow again and that more natural kind of a look. I feel beautiful.
Restore your skin to its most beautiful shade of even. Litera 2.0 is re-envisioned, reformulated, and rejuvenated. This is your moment to get even.
they're wrinkled, they look like bony, they just look scary.
Weathered, veiny, frail, just old. I think they look like my mom's, but the problem is my mom's almost 80 and I'm 44. I feel like my skin looks a lot thinner than it used to.
When I see my hands in front of me, I feel that my hands don't match the way my face looks. And I feel that, when people look at my hands, they actually show my true age.
If I'm doing my makeup, I seem to take a look and notice, whose hands are these? I don't even feel like they belong to me. When I wake up in the morning and I see myself in the mirror, I want to look as young as I feel, and that includes my hands. If you could just plump them up and make them look a little softer, it would just make me feel a little younger. I'd like for them to look just younger, maybe more full and just more polished. They look so much more youthful.
They just look smooth, soft.
I notice my hands a lot more. When I'm driving my car and I look down, they're not as veiny or as rough as they once were. And yes, every day I notice my hands and I'm more and more appreciative that I did this. I notice as I'm at work and I'm typing that my hands just look so much nicer. I enjoy keeping them out in front of me.
I definitely don't want to hide my hands. I want to show my hands off. I want to get my nails done. I want to do anything I possibly can do to show off my hands.
Just a lot more youthful. I've wanted to go out and get new jewelry. I don't feel like I need to hide my hands anymore.
They just look hydrated and you don't see the wrinkles like you did before.
I love my hands.
Now my hands look nothing like my mother's.
This is my first time doing this, but I would definitely say that it well exceeded my expectations. My husband thinks my hands are sexy, so it'd absolutely be something that I would do again.
In the past, women considering breast implants had to choose between beautiful, natural-looking results and the peace of mind of knowing exactly what is happening inside of their body. But times have changed, and so has technology. Ideal Implant is an FDA-approved implant with a unique internal structure that creates the natural look and feel similar to silicone gel implants, yet is filled only with saline, which is harmlessly absorbed by the body if ruptured. It offers a lower risk of common complications and can often be placed with a smaller incision. Before Ideal Implant, women had to choose between two options: saline implants, which looked and felt a little less natural but offered instant detection in case of rupture. The saline inside is safely absorbed by your body, since saline is simply salt water, like your tears or IV fluid. Or women could choose silicone gel implants, which are known to offer a more natural look and feel. However, they run the risk of silent rupture, which means you won't know if your implant is ruptured without getting an MRI. That's why the FDA recommends an MRI every 2 years with silicone gel breast implants. What's more, removing sticky silicone gel from the body tissue is also a bit of a complex process, even with the newer, more cohesive gel models. Put simply, women had to choose between a more realistic look or being free from the worry of silent rupture. It was time for a new implant, the Ideal Implant, that offered beautiful results with instant rupture detection. Now women no longer have to compromise with their breast enhancement. Visit idealimplant.com to find a board-certified surgeon offering Ideal Implant near you.
The #1 dermatologist recommended professional sunscreen brand. Whatever your skin type or lifestyle, there's an Elta MD sunscreen that's just right for you. All Elta MD sunscreens are mineral-based for sheer but sure broad-spectrum sun protection. Sun care and skin care for every season. Elta MD.
A sneeze, a laugh, even playing with my kids could be embarrassing. I don't want urinary incontinence to stop me from doing anything. The staff at the Institute of Aesthetic Surgery showed me the Emsella chair, a solution that was safe, pain-free, and FDA cleared. Best of all, I remained fully clothed. In just a few weeks, my accidents were a thing of the past. Now, I have my life back.
Hi, I'm Brooke and I'm 31 years old. I play the upright bass in a bunch of bands around town, do a little songwriting here and there. And I have no idea why I chose the bass. And my parents were like, why couldn't you have chosen the flute? I love the bass so much. I like to practice all the time. It doesn't feel like practicing to me. When I write the lyrics, I'll start to kind of feel it on my bass and I'll try it out and see if it fits. And when it does, it's great. Yes, I am very disciplined about my skincare. I moisturize, I use sunscreen every day. Now that I'm in my 30s, I've been noticing my crow's feet lines, and I really wanted to do something about them. You don't want the audience to be staring at your frown lines when you're playing a beautiful song. I've been making expressions like squinting and frowning for years now, and that's one of the reasons I have these lines. But Botox Cosmetic works beneath the surface and addresses one of the underlying causes of frown lines and crow's feet. Am I happy with my results? What do you think? You still look like me. That was important. Well, for me, the whole process was quick. I mean, after my treatment, I was back to my life, eating lunch with my friends, going to my gigs. There was really minimal downtime. I enrolled in Brilliant Distinctions, the Botox Cosmetic Rewards program, and I've already earned points that I can use to save on my next treatment. None of my friends have been treated with Botox Cosmetic, but we've talked about it. So now I'm the first. And now they all want to know about my experience because they've seen the results.
I've always had problems with my love handles and my lower abs. I was never quite able to get rid of that excess body fat around that area.
My abdomen area after having children. No matter what I was doing, I couldn't get it to look the way I wanted it to look.
I had a son who's just turned 4, and I'm older now, and I started getting the belly fat that wasn't going away with doing exercise.
No matter how much I changed the diet and how much I worked on my body, the problem areas remain there.
I couldn't take time off work or anything and didn't have time to really recover, so it was really important that this was something that you could keep moving on with your life.
I came right from work, came in, had the treatment done, the 25-minute treatment on the 4 different areas, and literally, when I walked out the door, I drove right back to work and picked up where I left off.
I like the idea that, it's not invasive.
I want something that I can come do it and go home and go back to work without any issues. No downtime.
The process didn't require any anesthesia, no pain medication. It was easy.
It was great. I mean, I think the first time I actually went, I didn't go back to work. I actually went to the gym.
I've personally have had and seen really, really good results.
My first month, I noticed that my flanks were going lower and lower. This used to be a size 36. Now I'm 34.
My stomach is flatter, it's more smooth.
I feel better, like your clothes fit better, they're not touching you the wrong way, they're, hanging a little looser.
After the procedure, I definitely feel more confident that there's less of me there.
My brother definitely noticed. I didn't tell him what I was doing, but my brother, he's like, are you trimming up or something like that? Are you doing anything extra? I said, no, I'm just, doing my normal thing at the gym and things like that.
I'm proud. I'll lift my shirt up and show everybody my belly.
I'm very happy with making the choice to have the sculpture done.
It's a good feeling too. I mean, finally getting the results that I've been looking for forever.
And if you're a guy who cares for himself, then you want to do it. I mean, there's nothing to do. This is not just for women. We do it because for once, we have the technology available. And I think that we should take advantage of that.
I would rate my success of the procedure a 10. It was very positive. I'm very impressed with the results, and they have exceeded my expectations, definitely.